Hey YouTube, welcome back to another episode of Matters of the Heart with me, Cheryl Stewart. In today's video, I will be talking about the treatment options for people who suffer with end-stage renal disease, the pros and the cons, because I've been on both sides of the fence. So we're going to talk about that, so stay tuned. Right, so let's talk about treatment options. The first and the most infamous is dialysis, okay? There are two methods of dialysis, if you will, that you can choose. The first being hemodialysis, which is the one that I chose to do, which is where you go to the center 3 days a week. I do 3 hours each treatment, but there are patients that do 4.5. I told my doctor I wasn't going, and he told me 3 hours is okay. So I kind of negotiated my way down to 3 hours. But yes, so I go in center, and then the other option is peritoneal dialysis. That is where you have a tube surgically implanted in your stomach. The tube does hang out from your stomach, but they have to insert the other part of the tube down into the peritoneum cavity. It kind of like sits down by the rectum, if you will, and that is where you hook yourself up to this machine. Well, I did the machine. I did that part too. I did that method as well. So you hook yourself up to this machine at night, and you have like these big 4.5 liter bags of fluid, and overnight this machine exchanges fluid. Like, it drains out the dirty fluid and fills your body back in with the clean fluid, and then that's how you do your dialysis. It makes you feel like you're pregnant. That's one thing I didn't like about that method of dialysis. And also with that method, I experienced something that I didn't want to experience, but we'll get into that in a second. The other treatment option is, of course, transplantation. A lot of people who are on dialysis are really hoping for a transplant, and I will give you the pros and cons to each treatment option as I have experienced all three. Okay, so I will start with hemodialysis. Hemodialysis is where you have to surgically get what we call an arterial venous fistula implanted in your arm. I am right-handed, so they put it in my left arm, and I don't know if you can see here, and it kind of like makes your veins pop out a little bit because of the pressure of the flow of blood. They basically just take an artery connected to a vein to make it wide, and once it gets to a place where you can use it for dialysis, they will, what we call, cannulate, and all that is just another word for you about to get stuck with needles, basically. So I get stuck with needles that are fairly large. And for those of you who are a part of the medical world, you'll know that a 14 gauge needle is a big needle. I'm the only one in my clinic that uses a 14 gauge because I don't know, for whatever reason, something was going on with my arm and I had to get a better flow. But anyway, with hemodialysis, the plus is that you can go to the clinic 3 days a week, get your treatment, go ahead about your business. Okay, you don't have to think about it anymore because, hey, I don't have to come back for another day. So I go Tuesday, Thursday, Saturday. So in between those days, I do have time to myself to do whatever I want to do with my family, rest up, recuperate. It is like a yo-yo. You're up and down, up and down. On a dialysis day, you're down all day. I'm tired. I want to lay down, go to sleep. I have headaches often, really fatigued. But then the day after, I'm ready to go. You know, some days I'm down for like 2 days, but for the most part, I'm ready to go. But you have to be careful with hemodialysis because they are accessing your blood. And with that, they're pulling fluid off of you while you're on the machine, and the chances of your blood pressure dropping, it's a chance your blood pressure can drop to a point to where you pass out. I have had those experiences before, and the feeling is not a good feeling. And when you do get to a point, if you pass out, if they don't open up the line to give you more fluid, it's not going to be a good situation. It is not going to be a good situation. I do recall once where I passed out, my blood pressure got down in the 40s, and I passed out, and it took them, because usually if you get like half the bag, you start to feel better, you wake back up, but you're out of it. But this particular time, I passed out, and it took them 3 liters of fluid to get me back. And that could have been it for me. That could have been like the end, but it wasn't my time to go yet. The Lord had his hand on me, and he gave the nurses and techs the wisdom and he gave them the wisdom and the knowledge to, know what to do to get me back, to bring my blood pressure back. And also, if they pull too much fluid, you can cramp, and that will be the worst cramping that you'll ever experience in your life. So that is a downside to hemodialysis. Also, with peritoneal dialysis, which is where you do it at home, you can do it overnight. That's the one with the tube in the stomach. I liked the freedom. However, I did not like the fact that I got an infection. And not only did I get an infection, but the tube that lies down in the peritoneum cavity, somehow or another, that tube got wrapped around the bowel duct, and it wasn't pretty. It wasn't pretty. It was the most painful thing. And I woke up the next morning because I thought my drain bag was going to be completely full, but it was completely empty. And I'm like, okay, something is wrong. And me being, in my former life, I'm a doctor, okay? Okay, so me being who I am, I, glove up, mask up, and I took a syringe and I tried to aspirate it. And for those who don't know what that is, that means basically you're trying to pull fluid from that line. Big mistake, the worst pain ever. I screamed for bloody murder because it was so painful. So I had to be taken to the hospital and ended up having to have surgery because they had to unravel the tubing from down there. So that was a bad experience for me, and I vowed to never do peritoneal dialysis again. So I am content with home hemo. Not home hemo, I'm sorry, I did home hemo before. That's where I did this here with the needles. I did that at home. My husband and I got trained and we did it at home, but that became a little bit overwhelming because I had to do 5 days a week and I never got a break. So I just got fed up with it and I skipped 10 days and I almost killed myself because I was so full of toxins. I mean, my system was so poisoned that if I didn't go to the doctor, I probably would have checked out. And yeah, I will never do that again. So I'm content with going to the clinic 3 days a week and, making sure I'm compliant with all my treatments. I don't like to come off the machine early. I don't like to miss treatments. So yeah, and that was my take on home hemo, peritoneal dialysis, and in-center dialysis. Now let's get into the transplants, okay? Transplants are great. They are. They are a life-saving option, okay? Some do extremely well with transplants. Some don't do so well with transplants. I will give you my take on the 2 that I had. So my husband, who's behind the camera right here, he was so gracious to bless me with one of his kidneys in 2008. Okay, at this point I had been on dialysis for 2 years, and he blessed me, and the doctor said like, oh my God, his kidney was so nice and plump and this and the other. So it was just like a match made in heaven. So we got that done May 30th, 2008. And I held on to that kidney for almost 4 years. I did go into rejection in I want to say April of 2011, but I went into complete failure in August 2011 and I had to go back on dialysis. They did end up having to remove that kidney because what happened was it started to swell. How? I don't know. It started to swell, and once they did the CAT scan, they were like, oh my God, it's about to rupture. What do you want to do? I'm like, what do you think I want to do? And he was like, well, if you leave it in there, it's going to cause more problems. I said, well, you just answered my question. Please remove it. So we removed that in January of 2012, I believe. 12 or 13, I can't remember exactly. And then, of course, you know, like I said, I went back on dialysis in August of 11. So moving forward, I was blessed with another kidney. This time it was a deceased donor. I don't know the family. I don't know the name. They are not allowed to share that information because of the HIPAA policy. But I do know it was a male Hispanic. When I got that kidney, it was damaged already from injury. What type of injury, they did not disclose that to me. However, they, you know, said, hey, you're a match. But what the crazy thing is that my antibodies, that's something where it tells you how your body would interact with foreign objects, you know, a foreign substance inside. Well, my antibodies were at 99%, which meant I would only match 1% of the population in the Midwest. So the Lord worked his magic, and I got the call the night of my grandfather's funeral service. As I was going home, I got the call from an unknown number, and I wasn't going to answer it, but my daughter was like, Mom, answer phone, let me answer. So I answered the phone, and I am on the Dan Ryan, and I am bawling my face off because I just never expected the call to come so soon. Well, it was almost 7 years, but you know what I'm saying. So yeah, I got that call. I just threw like stuff in a bag, and me and my husband, we jetted to Madison. I had like nothing was matching. It was just like having peanut butter with no jelly, ketchup with no mustard, Kool-Aid with no sugar. I had nothing that matched. And I'm like, did I even bring shoes? Like, what is going on here? So we got there, and they had me to do another chest x-ray. They found something on the chest x-ray. So my husband and I, we didn't tell anybody. We didn't say anything. We didn't call anyone. He and I just agreed. We prayed. They repeated it, found nothing. And so I'm like, okay, I'm getting this kidney. I don't care what. I got it. Guess what? I'm thinking I'm going to urinate the next morning. Nothing. Absolutely nothing. Nothing happened. They were like, oh, well, you know, your creatinine is still up. Okay, so just a sidebar. Creatinine is a marker that detects your kidney function. If you get, that's why I'm stressing, get a blood test. From my previous video, get a blood test that'll tell you what your creatinine is. Whatever the number is, that'll tell you your kidney function. But anyway, my creatinine was like a 13.7. Not good. The lower the creatinine, the better the kidney function. The higher, the worse, okay? So it was 13.7, and I was told that I had to do dialysis again. So they were like, oh, just give it a couple weeks. It'll come back. It'll wake up. You just have a sleepy kidney. Okay, fine. So I'm waiting on it to wake up. It's not waking up. I'm doing dialysis 3 days a week. Again, in the doctor's office, 4 days a week. Basically living in Madison, so I couldn't come home. So yeah, this kidney just didn't want to do right. And I want to say mid to late March, I'm still in Madison, had a rejection episode. I'm like, oh my gosh, I'm gonna lose this kidney, oh my gosh. So, I mean, when I say there were test after test, it was just crazy. And I ended up staying in Madison until June 13th, 2017. Got up there February 27th, okay? So, yeah, in a nutshell, that kidney, it never really got to a place where it functioned, you know, optimally. It never got there. It got me to a place to where I did eventually get off of dialysis, but the infections were endless. I had infections every single month. I was in the hospital literally every single month. And that went on for like a year and a half. So they did eventually end up removing that kidney in July of last year, 2019. So yeah, I've been back on dialysis since May 2019. And once they removed it, I did start to feel better because, you know, all of the medications. And that's one thing that people need to understand when you go for transplant. Please understand that you will be on medications for the rest of your life. You will be on like steroids. You will be on, I'm not saying that the steroids will be forever, but those other transplant meds will be. So just be prepared for your body to go through changes, because you will have hormonal changes, you will have physical changes. I mean, it's real. It's serious, and you have to take it serious. You cannot take a transplant lightly. It is something else, and you have to be prepared for the journey. It is a wonderful thing. I will definitely say I am on the list for another transplant. I don't have any living donors right now at the moment, because all of my family, they cannot donate. So I'm still waiting again, and I'm okay with that. So that is pretty much my take on all three modules of treatment. Transplant, it was great. Still waiting on another one. Hemodialysis in center. That is what I choose right now because I feel it's the easiest for me. Travel isn't easy with that because you have to schedule your travel so that they can set up appointments for you wherever you're going. So traveling is a bit difficult. However, when I was doing home hemodialysis, where you stick yourself with the needles at home, I did travel to Florida with that because the machine was, I want to say, it wasn't a huge machine. It was heavy, but it wasn't a huge machine. I would say about 70 pounds. But I did have to lug all that stuff with me and then take all of the supplies and all that. But it did give me a little more freedom to travel. And the other option, which was peritoneal, you can also travel with that machine. So you have a little bit more leeway with that. But I'm okay with where I am right now. And if you have any questions, please comment in the comment section below. I will respond to every comment. If you have any concerns, if you know someone who may be dealing with this or who may be at risk or what have you, please don't forget to drop a comment below. Ask me all the questions. If I don't know the answer myself, I will definitely find the answer for you and get back to you. Please, health is wealth. Take care of yourself. Get tested, as I stated before. I love you guys. That'll do it for this episode of Matters of the Heart. Please don't forget to subscribe to my channel. Make sure you turn on the notification bell so you will know when I'm posting, and also give me a thumbs up. I really appreciate it. Also, check out my book on Amazon.com, From Disaster to Design, and you can search Cheryl D. Stewart, and it will be the first book that pops up when you search. Thank you for watching, and I will be back with another episode of Matters of the Heart. Thank you. Peace out.
Your blood for me. Your love.